in your mind. All of fever and seizure, it's not, excuse me. All of fever and seizure aren't febrile seizure. And which of the febrile seizures? Febrile seizures usually occur between the ages of 6 months and 6 years. A peak age of 12 and 18 months and occur in 4% of all children. The peak in 12 and 18 months is because of MMR vaccination that routinely all of children has been received, that include mumps, rubella, and measles. And 4% of healthy children may experience febrile seizure in their life. Febrile seizure occur with a temperature of 38 degrees Celsius or higher, and it's not the result of CNS infection or any metabolic imbalance, for example, hypoglycemia, hyperglycemia, acidosis, or uremia, and often occur in the context of otitis media, roseola, herpes viruses, infection viruses, and enteroviruses, and Shigella, and occur in the absence of a history of period of febrile seizure. That is very important in your history taking from patients, caregiver, or parents. And the common causes among infections are roseola and Shigella. Okay, a simple question to practice the concept of the febrile seizure. Please answer in the chat box or open your microphone. A 6-month boy with history of recurrent of febrile seizure since birth, and he's being treated with phenobarbital, and he has been experienced fever from 2 days ago and seizure with 2 minutes duration in 2 hours ago. Is it correct for this patient to be diagnosed with febrile seizure or not? What's your answer?
I think from
yes.
From our definition, which said there must not be a history. We don't need a history of febrile seizures for us to give a diagnosis of febrile seizure. So this one is not.
Yes, as I mentioned in the previous slide, febrile seizures should not be related to previous of febrile seizure. In this patient, his diagnosis with seizure is seizure triggered by fever, not febrile seizure. Okay, next slide. I have a problem with changing a slide. Okay, we have 2 types for febrile seizures, simple febrile seizures and complex febrile seizures. I'm going to explain them into next slide. There is another type of febrile seizure that name is febrile status epilepticus that lasts for more 30 minutes. And I wanna talk about common one, and I don't explain it. And I introduce for you simple and complex febrile seizure. And in this slide, you see the simple febrile seizure. Some features that are very important include generalized at onset, usually tonic-clonic, lasting for a maximum of 15 minutes, not recurrent within a 24-hour period. And most patients have a very short post-ictal, and between 2 and 5% of neurologically healthy infants and children experience at least one, usually simple febrile seizure. Unlike simple febrile seizure, in complex febrile seizure, seizure lasts longer than 15 minutes and or with focal feature and or happens more than once in 24 hours. What's the importance of knowing the type of febrile seizure? Can you answer me? What's the importance of typing? What's the importance of determining the type of febrile seizure?
I think it also affects management, the treatment of those seizures.
Yes, very good, very good, very good. The importance of determining the type of febrile seizure is very important for our management and prediction of recurrency and epilepsy developing. Usually, most of parents are worried and ask you repeatedly about the risk of recurrence and epilepsy development. And I'd like to talk about these risk factors and determining the type of febrile seizure. That's very important in your history taking, and it's very important for your management. In this slide, you can see risk factors for recurrence. There are two types of risk factors for recurrence, major and minor. That major one is very important, and you should keep in your mind that age less than 1 year, duration of fever less than 24 hours, and fever within 38 to 39 degrees Celsius. And the minor one are family history of febrile seizures, family history of epilepsy, complex febrile seizure, daycare, male gender, and lower serum sodium at time of presentation. And the last one that is lower serum sodium at time of presentation. It's very important to recurrency in first 24 hours from presentation of seizure that I will mention in future and in next slides. And in this slide, you can see risk factors for occurrence subsequent epilepsy. Sorted them from more effective to less. Okay. At the top of list, we have neurodevelopmental abnormalities with 33% chances of recurrence. After that, focal febrile seizures, family history of epilepsy, fever onset less than 1 hour before febrile seizure with more than 15 minutes in duration or recurrent within 1 day, and the recurrent febrile seizures and simple febrile seizures that you can see the percent chances of recurrence in this slide. Up to now, any question, or we can continue the slides. Please answer the question, and I know that you are active and listen to me. Continue or stop. Any question?
No question, Doc.
Okay.
It's clear.
Yes, okay. This is the time to think about evaluation. What are the necessary evaluation in febrile seizure? Detailed history, general and neurologic examination, blood studies, lumbar puncture, electroencephalogram, and neuroimaging. This doesn't mean that all of them are necessary for each patient. Some of them are essential for some situations that we will talk about them. Okay, detailed history. In this slide, I'm gonna talk about detailed history, and like other febrile episodes, you need to get a detailed history. For example, onset of fever, pattern of fever, and any accompanying signs and symptoms to discovering an underlying disease. And you should ask about exposures to other persons at home, daycares, schools, should be noted in the paper, and along with any recent travel or medications. History of febrile and afebrile seizure in the patients and his or her families is very important, and history of neurodevelopmental delay. It's very important for risk factors that I mentioned before, and features and duration and recurrence of febrile seizure that are very important for your management and predicting the epilepsy developing or recurrence of febrile seizure. Okay. Blood studies. It's very important to know. After that, examination. Examination is very important. Physical examination, complete evaluation of vital signs include pulse oximetry, assessment of airway adequacy, other like disease and other episodes. The child's head circumference, length, weights are plotted on the growth chart, and complete head-to-toe screen is recommended. General examination for localized infection source, like other disease, like other febrile disease, and neurological examination for finding any neurological deficit in examination, for doing neuroimaging or electroencephalogram or other modalities that should be needed for doing. Okay. After that, I talk about blood studies. Serum electrolytes, calcium, phosphor, magnesium, and CBC are not routinely recommended in the workup of first simple febrile seizures and should be performed in some situations like dehydration, and blood glucose initially should be checked in prolonged postictal obtundation or with poor oral intake, and sodium of serum level should be checked because of the higher risk of recurrence of the febrile seizure within the following 24 hours in patients with low sodium level. And iron deficiency is associated with an increased risk of febrile seizures. So screening for that problem and treating have been suggested. Due to the accompaniment of fever in the febrile seizure, we check CBC, blood culture, and urine analysis, or any parameter that can help us to understand underlying febrile disease in our department. And according to explanation about serum sodium level in previous slide, we check it for the patient with febrile seizure, and we should screen iron deficiency in any patient with history of febrile seizure in his or her life.
Doc.
Lumbar puncture. Yes.
On iron deficiency, is there any case of an infection, especially, for example, infections from iron-loving bacteria, which can deplete iron levels in an infected baby to cause febrile seizures?
No. Yes. Very important point. Very important. Okay. We check iron deficiency after relieving the disease, because we can see anemia for disease in the patient, and the hemoglobin may be lower than normal or more than normal because of dehydration or other situation. And we screen the patient after relieving the disease. For example, after 1 or 2 weeks after disease, we check it, and if the iron deficiency is show in the lab data, we can treat it with iron and follow the patient. It's very important point that you say. Excellent. Okay, or any more question?
Thank you.
Okay. It's clear?
Yes.
Yes.
Thank
okay.
you.
You're welcome. Lumbar puncture. Lumbar puncture is very important that you know that when you should do it. Lumbar puncture or LP should be performed for all infants younger than 6 months, children with ill appearing, children with any age of, there are clinical signs or symptoms of meningitis, children with 6 to 12 months of age who are deficient in Haemophilus influenza type B and Streptococcus pneumonia immunizations, or for whom the immunization status are unknown. And the last one, febrile status epilepticus, prolonged more than 30 minutes that I said before. One point about vaccination in Iran that I want to say, children have been received Haemophilus influenza vaccine routinely in pentavalent vaccine in Iran, and Streptococcus pneumonia immunization aren't routine. So in Iran, all of patients under 1 year old with febrile seizure should be CSF sampling be done, and in 12 to 18 months, the physician decides based on the individual situation. And after that, after 18 months, the meningitis signs are reliable and the physician can rely on your examination. In addition, in our references, any patient with history of partially treated with antibiotics, outpatient or inpatient, it's similar, should be under lumbar puncture. So you should keep in your mind the indications of sampling CSF, and it's very important, and you shouldn't miss it. Is it clear, the vaccination routine in Iran or not? Can I go next slide or not?
Yes, Doc, you can continue. It's
okay.
clear.
Okay. Electroencephalogram. After lumbar puncture, I'm gonna talk about electroencephalogram. Not be performed in evaluation of child with first simple febrile seizure with neurologically healthy condition, and wouldn't predict the future recurrence of febrile seizures or epilepsy, even if the result is abnormal. It's very important that you shouldn't do electroencephalogram in first 2 weeks after presentation of this disease, and you should delay it after more than 2 weeks. Electroencephalogram performed within 2 weeks often have non-specific slowing, usually posteriorly. So you should do electroencephalogram after 2 weeks, 2 weeks after presentation of febrile seizure. And neuroimaging. Brain CT scan or MRI is not recommended in evaluation of simple febrile seizure. It should be performed in complex febrile seizure and in patient with neurologically abnormality in your physical examination. That's very important in your physical examination, and it shows importance of your history taking and physical examination. The indication of imaging are complex febrile seizures and patients with neurological abnormality. Treatment. Parents should be educated on how to handle fever. Yes, yes.
So why do we wait for 2 weeks? Is it because if a seizure takes place, the result, does it take 2 weeks for it to show results on the ECG, on the EEG?
Please repeat your answer, and I back on the slide. Please repeat.
I mean, why do we, like, if a seizure takes place today, if we take an EEG, you said it does not show
Yes.
us anything significant. We delay for more than 2 weeks.
Yes. We
Why
delay
is it?
more than 2 weeks. Yes. Get it. Got it. We should do EEG more than 2 weeks because the results of EEG it's not important and reliable. Because even if the result is abnormal, you should rely on it and you should do it 2 weeks later. Because the non-specific waves you are seeing in it. Clear or not?
Yeah. Thank you.
Because the even abnormal result is not important, and you can't rely on the result of electroencephalogram. It's normal or abnormal. In two conditions, you can't rely on the result. The EEG is normal or abnormal. Both of them is unreliable, are unreliable. Okay.
Okay, I understand now.
Yes. What about treatment? Parents should be educated on how to handle fever and seizure. Antipyretics with appropriate dose and interval can decrease the discomfort of the child, but don't reduce the risk of having a recurrent febrile seizure. Most children with simple type require no treatment. And if the seizure lasts for longer than 5 minutes, or in some references 3 minutes, acute treatment with benzodiazepines like diazepam is needed. Rectal diazepam is often prescribed to families to be used at home during a seizure. And about intermittent oral diazepam can be given during 48 hours from the onset of any febrile illnesses to reduce the risk of seizure. In practice, we prescribe intermittent diazepam for all of infants and children with febrile seizure. According to existing article, intermittent diazepam administration can have a reducing effect on the recurrence of febrile seizures. So we prescribe intermittent diazepam for all of children with febrile seizure in our department. Clear? The treatment is very important.
Yes.
Okay. Prognosis. There are no long-term adverse effects of having one or more simple febrile seizures. Complex febrile seizures may have an approximately twofold long-term increase in mortality rates as compared with the general population. It shows the importance of correct history taking and management to discover an underlying disease and correct determining the type of febrile seizure that can your epilepsy developing and your management of the patient and predicting the developing epilepsy and recurrency and determining prognosis that you should say to her or his parents and explain the situation for them. Some therapies help reduce but don't eliminate the risk of recurrence of febrile seizures. Chronic anti-epileptic therapy may be considered for children with a high risk for later epilepsy that we prefer in our references. We prefer phenobarbital and sodium valproate for long treatment in these children. Okay. If there is no problem and no question, we have a simple quiz in final parts. What's your opinion? Do you agree with quiz? Please, other students, join us. I don't want this class is inactive, and monotone. Other students, join us, please. Do you agree with me that we have a quiz in final part or no? Please answer. This quiz is piece of cake.
Yeah, we are typing.
Oh, excuse me, I didn't see. Excuse me. I'm waiting to open your microphone, and I listen your voice. Okay, excuse me, I check it and continue, and I start simple quiz. Okay. A 9-month girl with fever for 2 days. She has experienced a 2-minute general tonic-clonic seizure 2 hours ago. All electrolytes are normal and nothing special points was found in the examination. The first question, what's the patient's diagnosis? Type in the chat box or open your microphone and answer, please. What's the patient's diagnosis?
Simple febrile seizures.
Thanks. The criteria of this diagnosis. Please mention them. When a febrile seizure is simple, what's the yes. Yes, lasts only 2 minutes. Yes. No. For 2 days, it's not related to the determining types of febrile seizure. Febrile seizure, I will back last slide. I think it's better. Okay. In simple febrile seizure, we have generalized that's onset, that in this patient we have it, usually tonic-clonic, okay, lasting for a maximum of 15 minutes, that in this patient the seizure lasts 2 minutes and not recurrent within a 24 period. And we have all of them in this patient, so the diagnosis, simple febrile seizure. Okay. And then second question. What's important points in her history? Dear Camara, not generalized, no. When a seizure isn't generalized, it's a complex febrile seizure. When the seizure is generalized and it's with fever, we can say we have febrile seizure. Simple febrile seizure has a generalized seizure, that in this patient we have general tonic-clonic that confirm the simple febrile seizure is diagnosis. Okay or not? Please open your microphone or type in chat box. Dr. Camera, it's okay or not? And after that, we talk about the second question. Okay. Please, one of your dear answer the second question. What's important points in her history? Please mention some of them. It's enough.
Yeah, I think in the history we already have the period, like it's now 2 days.
Yes.
But we want to know if there's any other history of seizures before.
Yes. Excellent. Continue, please.
And we want to rule out possibility of other infections. So
Yes.
we ask, for example, associated symptoms maybe in the history.
Yes. Excellent. You should ask patient's caregiver or parents about onset of fever, duration of fever, and accompanying symptoms like diarrhea, cough, and vomiting, abdominal pain, or other things that you can determine the underlying febrile disease. And it's very important because you should treatment the febrile episode and febrile disease similar to treatment of seizure. And the treatment of both of them is very important. The third question, what's important points in her physical examination? Before you answer this question, because the history taking and physical examination for fever and seizure separately mentioned and introduced in your Nelson in other chapter, and in chapter of fever, in chapter of seizure, and our lecture isn't about fever or seizure alone, and we should explain the febrile seizure. We don't introduce by detail about examination and taking history of them, and I definitely mentioned them, and in this class we explain the febrile convulsion or febrile seizure, and you should read them at home for your own, and learn them because they are very important to management the febrile seizure. What's important points in her physical examination? I'm waiting. One student answer the question.
Maybe obvious signs of infection, for example, skin lesions associated with this meningitis, for example. We also check the nasal rigidity, even to rule out obvious signs of infection, maybe lung infections, auscultations, to check for pneumonia, obvious signs, if there's any tarasho, from the nose, or the breathing,
yes,
conjunctivitis,
runny nose, okay,
and yeah, even you said
anemia.
anemia is also important, so we can even check the paleness of the skin, all sort of stuff.
Yes.
And normal development or anomalous. Normal development.
Yes. Yes, developmental delay. You determine any developmental delay, and you should perform neurological physical examination by detail, and it's very important. Your answer was very good, and I explained other points that you didn't say them. You should pay attention to some points, for example, that as you said, skin rashes, respiratory distress, illness, vital sign checking, pulse oximetry, and pay attention to tachycardia, tachypnea, and complete head to toe examination and general and neurological examination, that you find the infectious source, and the neurological examination for determine the other modalities, for example, EEG, neuroimaging, are needed or not. And the other question, are you going to do any neuroimaging for her or no, and why?
I will not do
Is it
neuroimaging.
necessary? Yes,
I will not.
Because the patient's diagnosis is simple febrile seizure. As I said in previous slides, we shouldn't do neuroimaging for simple febrile seizure, and we do it for patients with complex febrile seizure and with patients with neurologically neurological finding in his or her examination. And the patient, as the question said to us, neurological examination and all of examination are normal, and neuroimaging aren't needed. Clear or not?
Yes.
Okay. And the last question, if the patient's urine analysis shows an infection, is lumbar puncture still needed or not? I like that other students join us and answer the question. I check the chat box. Is it difficult? If the patient's urine analysis shows an infection, that means the infectious source of the febrile episode is UTI. Is lumbar puncture still needed or not? I explained it before in a slide about lumbar puncture. I'm waiting. Yes, if there is an indication for meningitis. Yes, it's correct, but the explanation of the answer is not correct. Why we should perform lumbar puncture for this patient? I'm waiting for your answer in chat box, or open your microphone and answer. Is it difficult? I explained it before. Do you need to explain it again? Please answer. I will back to that slide about lumbar puncture. I said in this slide about lumbar puncture indication. All infants younger than 6 months, children with ill appearing. Please check them in your mind and keep it in your mind. Children with any age of, there are clinical signs or symptoms of meningitis. Children with 6 to 12 months of age who are deficient in Haemophilus influenza type B and Streptococcus pneumonia immunizations, or for whom the immunization status are unknown, or febrile status epilepticus. Why the lumbar puncture is needed for our patients? I back to our question.
Maybe because we don't know the vaccination status of the patient.
Yes. If the patient received all of routine vaccine in Iran, all of national routine vaccination, we should perform LP or lumbar puncture for her, because we didn't in routine vaccination pneumococcus. Because of this, all of patients under 1 year should perform, and should CSF sampling must be done for her. Clear?
Yeah, it's clear now.
Yes, because our children in Iran don't receive pneumococcus vaccine routinely. Because of this, all patients under 1 year, in all patients under 1 year, CSF sampling must be done for meningitis rule out. Even the patient hasn't any sign or symptom for meningitis. Is it clear or not? All of the students answer me, please. If it's unclear, I explain again. Okay. Okay. You can see the slides and lecture more and more on Apparat or YouTube, and keep them in your mind, because the febrile seizure, as I said, is very common, and you definitely face it in your future work. And the patient's parents are worried and ask you repeatedly questions about recurrence, about epilepsy developing, and you should learn it completely, and you can explain for parents and inform them. Okay. I hope this class was useful enough for you. And if you have any question, you can contact me by this email address, and I can wait for your answer in this class for 5 minutes. And you can ask your question in chat box, and I can answer them. If there is no question, I leave the meeting, and have a good time for you.
Thank you so much, Prof.
Yes.
Thank you so much for the lecture. It was very insightful.
Thanks. I can wait a few minutes for your questions. It's no problem. And after that, leave the meeting.
Okay, thank you. May you also send me the slides? I will share with the students.
This live is being recorded, and you can see it on Upright on YouTube.
Okay, thank you.
Okay, have a good time. See you next session. And I hope you are healthy and fine. If there is no question, I leave the meeting. Thank you.